Good afternoon. This is County Executive Pat Ryan. Thank you for making time to join us today. Should be a relatively straightforward update, but also one that is it's not positive and is serious. And really, I want to serve as a wake-up call to our whole county and our community. At the end of the day, it's clear now, looking at the data, that we are at the beginning of a second wave of COVID-19 in Ulster County. And while that's not what I want to be sharing and reporting, I think it's important, as I've said from the beginning, to be clear about that. As we saw things changing, that we would be clear, that I would be clear with you all. So I did that a little bit on Tuesday. We're going to do it again today and walk you through that data. But again, I really think, given that we are at the beginning of a second wave, we're still early enough that what we do in the next few days and weeks will really, really matter in terms of controlling and slowing the spread and really blunting a second wave so that it doesn't look as steep as that first wave. And we'll go over this graph and a few other graphs shortly. Starting with the overarching numbers, by the numbers, we are at a total of 2,713 cumulative cases. That's out of almost 134,000 tested. Fortunately, the vast majority of our residents are recovering or have recovered, 2,278. But we have had 98 fatalities within the county. Fortunately, none since our last update. Hospitalizations look the same as 48 hours ago. We're at 12 in the hospital, or in our hospitals right now, one of whom is on an ICU. What I really want to point your attention to, though, is the very clear now trend over multiple weeks of that number ticking up and up slowly, and now consistently being in the double digits for a week plus. That hospitalization number is the worst it's been since May, and that is another wake-up call moment for us here in the county. In terms of active cases, this is where I want to, I'll actually use this graph rather than the one on the screen. Just to retrace how we got here and where we've been. Of course, you'll remember back in March, a very steep initial increase, and you can see that on the graph as we quickly went almost immediately to a community spread situation where there was widespread transmission. We weren't able to really locate clusters or pockets of COVID, and our numbers rapidly escalated, culminating really at the end of April, early May. Then we started to get things under control. We put all of our precautions in place and saw the outcome of that, which was a decline. We were able to hold steady through the summer and into early fall, thanks to everyone taking COVID seriously, following the precautions, and really thinking about the impact on the broader community and the vulnerable members of our community. What's clear now, again, as I said in the beginning, is that really starting in early October and slowly building now into November, we are now very much at the beginning of a second wave. And we've seen this across the state and across the country. And now, unfortunately, we are seeing it here in Ulster County. To be at 337 is significant. Again, we haven't been that high for many, many months. But also what's even more significant is that now I feel comfortable and our team feels confident saying this is a consistent trajectory in the wrong direction, and one that we have to take very seriously and take quick and comprehensive action to address. So we'll talk a little bit more about that, what we can all do shortly. In terms of the new infection rate, this is also something that is a concerning point for us. In the last 48 hours, we have had 42 new positive cases. So in about 48 hours, we've had 42 new positives. That's out of 2,350, 2,350 tested. That puts us over the last 48 hours at a 1.8% new infection rate. Again, we had hoped to keep that under 1% and had done that really throughout the summer and early fall, and now it has consistently been approaching or over 2%. We are not as bad as others around us right now, surrounding counties to our south and also further upstate and further western New York are significantly worse. It would be easy to see that and say, okay, we're okay. But what I think it means is we have an opportunity and a relatively narrow window where if we all collectively get our guard back up, we can keep this in check. In the last 24 hours, we've had 23 new cases, putting us just under 2% new infection rate in the last 24 hours. In terms of hospital and treatment capacity, same as we were 48 hours ago. Again, 12 hospitalized, 1 ICU, and more than sufficient near-term and medium-term capacity if needed within our hospitals. I talked about this today. I talked about it 2 days ago, but I'm going to say over and over that these numbers and these indicators should and must serve as a wake-up call for us. Some of the points that I think are most telling, again, 1.91% new positivity rate in the last 24 hours. That is a wake-up call. 337 active cases, the highest we've been in many, many months. That is a wake-up call. 12 hospitalizations, the highest we've been since mid-May, very much needs to serve as a wake-up call. So the other thing that I want to share in that same vein is a geographic view of how this is now playing out in the county. So we're going to put up a map. This map is available, of course, on our COVID-19 dashboard, which is has a lot more data. All the data that I cover in these updates is always available to all of our residents on our COVID-19 dashboard. That's ulstercounty.ny.gov/COVID-19. That has all that information. We'll put that address up as well at the end. But what I want to show on the map, again, if you recall back, history doesn't always repeat exactly, but it rhymes. And if you look at what happened back in March and April in the county, we started to see our numbers first tick up in the southern part of the county. Still a little bit unclear why that was happening. I think there's multiple reasons to explain that. What's relevant today, though, is when you look at the same map right now, this is the current map of cases. Essentially, the darker the color on the map, the higher the density of active COVID cases. And the pattern that we see now, where there's a higher density in the southern part of the county, as well as in the slightly more populated Kingston-Saugerties corridor, that's exactly what we were seeing at the beginning of the first wave in Ulster County, going back into mid-March and into late March. Again, that is not a coincidence, and we have to use that as another data point, not to give up hope, because I don't think that's at all the case. We need to use all of these items and these data points and this scientific evidence really as a reminder that this is not over and that it's really coming back, and that we need to get our guard back up as individuals and as a community. So how do we do that? I've been saying this from day one. Every health expert, every scientist, every epidemiologist has been saying the most important things that we can continue to do are wear masks, maintain social distance, and wash hands. In terms of maintaining distance, I think it's important to really expand on what this means. I talked about this a little bit 48 hours ago. Anybody that's out and about, popping in to get takeout food, you go into a restaurant or you go into a business, more and more in the last few weeks and even month or two, you'll see groups of folks sitting together without masks on. That is absolutely a very risky thing to be doing as the rate of COVID goes up, and those are the kind of things that can get us back into a place of community spread rather than having smaller clusters that we can quickly identify and contain. So group gatherings, whether that's at home, whether that's at work, whether that's going out to get a meal or a coffee with someone you haven't seen in a while, those are things that are much higher risk, especially as our numbers go up. And I think that with that information and with that knowledge, I trust all of our residents to understand that riskier behavior puts them at greater risk. It puts their loved ones, and especially those with health challenges, at greater risk, and it puts our whole community at risk. So I really ask you to just think about, do you really need to go meet that friend for a coffee or a meal? Do you really need to have that meeting at work in person, or can you do it virtually and be safer? Do you really need to be in the office at all? I know that we've been working to get back more towards normal, and obviously that's what we all desperately want to do. But the way that I ultimately think about this is, think about where we were at mentally in the end of March and April. What were you doing and not doing then? If we follow those same rules now, we can stop this before it gets significantly worse here in the county. But if we don't take this seriously and honor the science and all the data, then we're going to be in a very tough spot, and that's the last thing that any of us want, of course. So please spread the word to friends and family. And let this serve as a wake-up call for all of us to take this seriously and follow the precautions. And I want to thank each of you in advance for tuning in today, for being engaged to this, for sort of being an ambassador of this message and sharing it with those that you know and you love, and those that you don't. The only way that I think we control this is not through a series of restrictions, but actually thinking of it the other way, that we have an opportunity and an obligation, each of us, to follow these precautions, which are based in science. Not that they're being forced on us, but that we are choosing to think about each other and to proactively and preemptively take care of each other using the science and using the health expertise. So if we all think about it that way, which we did at the worst of this, I'm confident that we can get through this again. The other way that we're going to get through this again, of course, is relying on all of our frontline workers that have been there for us always, but especially, of course, during COVID in the last 7-8 months. So thank you to all of our frontline workers, from our healthcare workers to first responders, delivery workers, our teachers and food workers, and so on. Thank you all for what you've done and what you're continuing to do. If you have any questions, whether it's COVID related or other needs, you can always call our Recovery Service Center. Continues to be staffed with our great team that can answer any questions that you have. That number is 845-443-8888. Again, if you need any information about the latest data on COVID or any of these services, you can also go to our website. The URL is right there on the screen, or send us an email as well. So I know this is sobering news, and it's coming at a time when we've all been had so much pressure, so much challenge, such weight on all of our shoulders as individuals and as parents and brothers and sisters and colleagues and everything else. But unfortunately, I think we need to dig deep one more time here. Remember what we did before. Let's do it again earlier now, and much more informed and much more empowered, and we'll come out of this the other side, and we'll get vaccines distributed, and then we can move on. But in the meantime, I will always be straight up with you. We'll lead with the data and the science and the facts, and continue to keep you updated as this goes on. I appreciate you joining. The next update will be on next Tuesday at 2 p.m. In the meantime, we'll share any other updates via social media or otherwise. Thank you for tuning in. Please stay safe and healthy, and let's stay resilient through this, and we will see you soon.